I am Judi Hill, President of the Akron NAACP, and with me,
I'm Dr. Lathardus Goggins II, Second Vice President and Education Chair here at the Akron NAACP.
we will be your host as we discuss issues and strategies that make Akron a more just and better place to live. We are blessed to have with us today Dr. Jennifer Ross. I call her an educational guru in leadership development and in DEI. She is the current Director of Unity and Engagement of Akron Children's Hospital. Welcome, Jennifer.
Thank you for having me, Judy.
Thank you.
So, today's episode, we will be talking about health equity, healing our communities. It's important for us to connect each episode to some of the priorities of the National NAACP. And so at the National NAACP, one of their priorities is, again, health equity. Did you know 34% of the COVID deaths were among non-Hispanic blacks, even though we only make up 12% of the total U.S. population? Under those ideas of health equity, three priorities are affordable health care, creating both access and affordability, healthy people and healthy communities. We know that health and wellness is something that goes hand in hand, and putting health in all of our policies, right? That health must be a priority in all that we do in all aspects of our lives. And so, Dr. Ross, as we again talk about this idea of health equity, we are familiar with health care, but when you add the equity piece to it, what does that mean to you?
It really means everyone having a fair and just opportunity to be as healthy as possible. And that sounds really simple, but really that's a complex and nuanced idea because we have to really consider how we remove obstacles in healthcare, such as poverty, such as discrimination, right? To ensure that everyone can fully access healthcare.
So you talk about like poverty, what's the word I'm looking for? The social discrimination?
Social determinants of
So,
health.
yes. So, mind sharing a little bit more on that? How would poverty impact health?
And whenever we say social determinants of health, we're thinking about those non-medical factors, right?
Okay.
That impede on individuals' health, right? So when we think about good jobs, right, fair pay, quality education, housing, how do those things impact health, right? But if we really think about it, if I don't have a good quality job, that means I probably don't have good insurance, right? Which can impede on the type of healthcare services I may receive. Right, and we know that zip codes are everything where people live, right? Because that's going to determine whether or not they have quality grocery stores in their neighborhood, right? And what types of access to food do they have? And when you think about low-income neighborhoods, right, and we think about poverty, we typically see food deserts,
Yes.
right?
Right.
And when you go in those grocery stores, you don't see lots of vegetables, lots of fruit, just lots of options. And then the price of the food in those spaces as well, typically higher than most spaces. So how do those things come together and how do they intersect to hinder someone's health?
Wow.
Are you going to reference the young people?
Well, we'll talk about the young
Oh,
people,
my goodness.
but also just a quick shameless plug. In a future episode, we'll be talking about some issues around environmental justice and those kinds of things. They were just reminded recently at one of the NAACP meetings, someone was sharing that, you're talking about just a zip code, that a particular zip code, there was the factory, there was certain type of emissions that were always there, and these kinds of things. And so you may think that, where you live may not impact your health, but if it is, we in economics we talk about redlining, but there's a certain amount of like environmental redlining that certain neighborhoods are the ones that get the factory. The certain there's a so much stuff running through my head right now, but it was a Houston where they had the railroad ties and the chemical that they put in the railroad ties to preserve them, it had leached out to this whole neighborhood. And everybody was getting sick. And they found it in the dirt, in the plants, in everything there was. So if I hear you correctly, you're saying that when we think about health, we can't just think about like where's the hospital or how fast an ambulance can get to a particular place, but the conditions in which people are living, how they're making their living,
Absolutely.
where they're making their living,
Right.
even
Access
the
to grocery stores.
Yeah.
We had a youth symposium, and one of the things that came out and really slapped us in the face was when young people said, you know, we are concerned about having to or having access to fresh food.
Yeah.
We would never think that kids would even care. So many young people in the morning, their breakfast comes from the gas station. So one of the initiatives, I know gas stations around town they tried to put in fresh fruit to see if that would help. But it's how and where you put it that makes a difference. And so it's just interesting when we listen to our young people, what they were saying was important to them. We want healthy food. We want access so that we can have a better quality of life.
And very similar to that, we had a project, Dr. Thomas Jefferson and the Unity and Engagement Department at Akron Children's Hospital. He did a project with students at North High School, and it was called Photo Voice. And we gave our students cameras. And we said, what does healthcare mean to you in your community? And they went out and they took photos. And believe it or not, they took photos about some of the injustices that they have around health in their neighborhoods. So students took pictures of their grocery stores and the junk food that was in their grocery stores. They took pictures of abandoned homes and burned down homes, right? And how that impacts their neighborhood. They took pictures of the neighborhood and just the litter and the different things. And they really had a keen sense of what they need and what they have a lack of access to in their community.
Listening to the voice of our babies. So they didn't have to say a word, they showed you in photo.
Yes.
Wow. That's consistent with what we've been doing over the last couple of years, in particular here in NAACP. But getting the opportunity to listen, to see where the people in the community, how they are shaping and seeing what the issues are. And ideally, hopefully, that is informative. It's something that comes back to the hospital and is being done or making partnerships or what are some other ways, particularly as a community member, that we might be able to engage our healthcare systems so we can better inform them about what it is that we see and need.
And I think it really starts with listening to the community, right? Because often within healthcare systems, there's so many brilliant people within those systems, from doctors to scientists to researchers. And often I think we forget to listen and have our ear, close to the community to really get a sense of the pulse of the needs. Because otherwise we're in there, we're researching, we're studying, we're saying this is the problem and that is the problem, which may be, but often we leave out the voice of the community. So very simple things that we can do, very simple initiatives like giving the students cameras, right? And saying, tell us what are your needs and what's missing. I think bringing in that voice allows for us to have another perspective that allows us to shift our lens and put the focus around the community based on what they're saying, based on what they're telling us their needs are, and it's not us telling the community what we should be doing or what they should be doing. And it allows for the community to be centered in our research, and they're centered in the initiatives and projects that we're doing, and I think they're a lot more productive because we do have that mistrust between the community and healthcare systems.
And think about it, physicians, what do? They assess a problem, they provide solutions, and they tell you what to do.
Right.
This way, you're engaging the community and helping to solve the issue, because without the support of the individual that is being affected, you're not going to get anywhere.
Absolutely.
Yeah.
Now, does most healthcare systems have someone like you that would help facilitate those discussions, or or who would we reach out to?
I believe most healthcare systems, they have departments that were, and they're still known as diversity, equity, and inclusion. Our department's known as unity and engagement. They usually have community health needs assessments, right? And so the director in our external initiatives department is Heather. Gosh, I'm drawing a blank of her last name, but her name is Heather, and she runs all the initiatives around the community where they do outreach and programming for the community. So we do have individuals who do this work, and you do have spaces in healthcare organizations where they have community engagement and community initiatives. And, so I think reaching out to those individuals, becoming aware of the opportunities that they are providing the community and how they engage the families that they're serving. Also, we have a food pharmacy that, they provide oversight of where we give out food to our families in need.
A food pharmacy.
A food pharmacy. Right,
okay, I hear that.
Right within children.
Okay.
Right.
Wow.
And so Burnett Williams oversee all of these initiatives and projects at Akron Children's Hospital.
Okay. And that's a way of helping to address the food inequity, to address the health inequities within our community. You recognize a need and figure out how to address it. Mm-hmm. So with the young people, when you found out these issues that were in that community, did they provide any solutions? Did they give them anything to do with all that information?
So our students did a poster session, and we brought in the employees to just hear from them, right? Just to share their stories, their experiences. But then from that, we said, okay, what is a problem that we can tackle, within the healthcare organization? What is it that we can do? And so the students thought we should come out and clean up the community. So employees decided, okay, we're going to get together, we're going to go out, we're going to clean up the community. At the same time, we knew that North High School, they're getting a new high school now, which is amazing. But at that time, we said, can we go in, help beautify the high school, help clean up the high school? And we did those types of projects just to let the students know that, yes, we heard you. And they're continuing on. They're going to do another photo voice exhibit at the end of this month on April 30th in the hospital again.
Oh, wow.
Awesome.
Great.
Yeah. Well, that's okay, because I just wanted to ask a question. We talk about health equity, and we look at the challenges that we have around what is proposed now with the changes in allowing or having medical resources for individuals. Under our new administration, they've taken away some of the, the limits on the finances that pharmacies can charge for certain drugs. Now we have individuals who don't have access to some of their medication because of the cost. Right. Is there anything we can do to help in that initiative, or how has the hospital been able to deal with this situation?
Right.
Because if people aren't taking their medication, they're going to be back in your emergency room.
Absolutely. And so we're blessed to have a CEO who really cares about the community, who really cares about the organization, and we understand that an executive order is not a law. Good. Right, so we want to be as compliant as we possibly can, but we also follow closely the administration to see what's happening. And one thing that we haven't done based on the executive orders is stop doing the work that we know is right.
Good.
Which is so important. Now we're going to follow the law, and we're going to always be in compliance, but also we understand the importance of providing support, providing resources, educating our families and parents. And I would even say that we've even pushed to do even more of this work because we understand how critical it is in this time right here. So one thing that we're doing is just staying abreast of these executive orders, staying abreast of the policies and laws and the lawsuits that are in court, because we have to see how this is all going to play out. At the same time, we're also still pushing the initiatives that we've always pushed that are important so that our families can come in, get great service, and they don't have to worry about not being able to get their medication or whatnot. Right. One thing that Akron Children's Hospital, I think, really do well is our 3 promises, right? We know that we want to treat every child how we would want our own to be treated. Mm-hmm. We want to treat people how they want to be treated, and we don't want to turn no child away for any reason whatsoever. And I think that's been the promise and the premise of our work since the institution of this hospital, right?
Awesome.
which is just amazing because we don't have to say diversity, equity, and inclusion. We can go back to our 3 promises, and our 3 promises are very clear on what we believe.
Amen.
Yes,
yeah.
Amen. And that's the thing that the National NAACP has always said to us when this stream of changes, quote unquote, executive orders that have coming down, take a breath. Don't go out making rash decisions and start marching because it's going to change. It's not law. He's throwing out a lot of information,
Right.
trying to have us chase our tail instead of looking at what's really good and right and just and staying true to our mission and purpose. So I love to hear that Children's has stayed the course and focused in on what really matters, and that's the people that you serve.
Absolutely.
Yeah, because I said the label doesn't matter, but the principles do.
Absolutely. Right. And our values are mutual respect. How do we create a welcoming environment? How do we ensure people have a sense of belonging?
Yeah.
And if we're doing that, we're doing the work.
Yeah.
For sure, for sure. So we are coming up on time, I believe, and so just want to reiterate, what are some things that we can do, right? So I heard one is if particularly if you are an organization, if you are a concerned person and want to connect with a healthcare system about ways in which you can partner, contact the system, contact the community engagement office.
Absolutely. Or either external affairs, Heather Winch is her last name.
Okay.
It's the one at Children's.
Children's.
Yeah.
But each hospital has someone.
So
Yes.
somewhere to partner, right? We also hear that we ought to be thinking about health, not just in terms of quote unquote the hospital, but in the very condition of the lives that we live, right? Healthy choices in terms of food and food access, in terms of the environment and the quality of the environment as well, and look for ways to partner again and advocate for and possibly use those healthcare systems as resources as you advocate for
A healthy
a healthy environment.
Right. And I would add too that this is a very complex, nuanced problem, right? And so we can't forget about the historical context of why people mistrust organizations. So it's going to take some time, right? We have to think about representation and why representation is so important. So why we should have Black doctors and physicians, right? In healthcare, right? And we have to think about cultural expectations. So when you think about all of these large issues, this is going to be some work that we have to be in the long haul to do. It's
and
gonna
it
take
has to
time.
be intentional. Yeah.
Right.
Awesome. Awesome. I know locally there are a few initiatives, and we were kind of brainstorming before this session of things that are coming up that people could get involved with. I know Hoop for Coops is going to be May 31st over at the Jar Arena, and their focus is not just basketball, but it's about healthy individuals and is open to everyone. I know the American Heart Association, I just recently had a heart scare, and they're going to have a heart walk. I'm going to participate in that because I think we need to get out and make sure that people understand that it's all of us, not just a few that are impacted. And the other local initiative that I can think of is our 2025 West Akron 5K race walk. It's held at Bookville High School. And it is, again, about not just supporting the community, but providing a healthy outlet so individuals can come, get health screenings, socialize, come together and exercise, and also learn about some ways that they can stay healthy. We appreciate you coming in today, Jennifer. I so love Dr. Ross, the work that you do.
Thank you.
Thank you.
And we appreciate you tuning in for this critical conversation on health equity. A healthier Akron starts with awareness, advocacy, and action. Let's keep pushing our systems that serve all people with dignity and fairness. With Judi Hill, I'm Dr. Lathardus Goggins II. Your health is your power, and your community is your strength. Let's work together to heal, uplift, and transform. Stay well, stay aware, and stay active in the fight for health equity.